alignment for flexion and extension goniometry is going to be the same. Jess was lying on her stomach when I got here, kind of, and then anyway. So I just left her there. That's the only reason why I'm starting with extension. But the landmarks are exactly the same. Okay? Now, again, just as we saw with the upper extremity, all of our rules that we violated when we covered the spine are back into play with the lower extremity. So we can go back and test passive range of motion. When we test passive range of motion, we want to make sure that we're feeling for an end feel. We can measure passive range of motion and active range of motion. Now, when it comes to the limb, it can get a lot trickier to do goniometry of the hip passively and try to hold the leg and take the measurement. So particularly for extension, it is certainly within your rights, no, not the right word. You can ask one of us to be your assistant and hold that leg for you while you take that motion if that's the one that you end up measuring passively on your exam, okay? Extension in particular is a little bit tricky. So if I were going to palpate for passive range of motion, not palpate, but if I was going to feel, go ahead and lift your leg for me. There you go, good. So I have my hand here because I want to know, make sure that the movement's coming from the hip and not her pelvis. So to get at that end range, I'm here. On Jess, that's a muscular end feel, so I'm pulling her hip flexors anteriorly more than I'm getting capsular. For some of you who have maybe not as tight of hip flexors, you might actually get a capsular end feel. Emily, I do not want people taking you to end range for passive range of motion. I've also warned Dr. Alt about you. So,
she told me.
Okay. So we all have our silly party tricks, but Emily has been expressly told not to do hers anymore. She can voluntarily sublux her femur out of her acetabulum. So, while entertaining for PT students, it's not good for her overall long-term health of her femoral head. So, alright, we digress. So, the stationary arm, again, if you recall, is always going to follow the stable segment. Our moving arm is going to be on the moving segment. So here we're going to be bisecting the torso, similar to what we did for shoulder flexion and extension. And then this time we're going to be bisecting the femur. And so we're going to be using the lateral epicondyle of the femur as our landmark, which we will learn later today. Just remember that you're trying to follow the line of the femur. The axis is going to be on the greater trochanter. That's going to be a great landmark for us for the hip. So we're going to start here. So she's starting in just a wee bit of flexion. Okay, if I look at how I'm aligned. So she's at almost 6 degrees, the way she's positioned on the table. That doesn't matter to me a whole lot because she's going to move through anatomical position, which is 0. Okay, so if I were measuring extension, I would not document that 6 degrees of relative flexion she's in. I would start at 0 and then go up. So for making my life easier to demonstrate this, I'm going to have you bend your knee for me. And then just kind of loosely bend. All right, there you go. And go ahead and lift this leg off the table as far as you can. Okay, and relax. So Jess would have 0 to 9 degrees of hip extension actively. Okay?
So you don't do like the -6. You
Am I
just do
actually?
the
Right, because she's going from 6 degrees of flexion past anatomical position. 20 degrees is normal. And, okay, so similar to the shoulder, if you think of it that way. Okay? So I'm not going to, I'm going to have her, I don't want her to bend her knee all the way to 90 degrees, and why is that? I'm tightening a 2-joint muscle in the front of her leg. I'm lengthening the rectus femoris, which is going to limit her range of motion. I do want her to have it bent just a little bit, okay? But because with it, well, anyway, I want it to be bent just a little bit, but not all the way to 90 because that's going to overly lengthen the rectus. So I'm going to have you flip over on your back for me. Obviously I've switched legs. But now I'm going to measure flexion, okay? Do you mind putting this hand behind your head just for illustrative purposes? So first I'll show you passive range of motion. For this one, it's going to be really tricky. So can you pull this knee to your, not this knee, but this knee, up to your chest? Just go ahead and give it a pull.
Oh, okay.
What happens to her pelvis when she goes into flexion? She goes into a posterior pelvic tilt. We don't want to measure the amount of posterior pelvic tilt she has. We want to measure her hip flexion. So go ahead and come back down. The other thing is, what happens if we keep her legs straight as she comes up? What are we measuring? Hamstrings. So we don't want to keep her knee straight when she comes up, so we want it to be bent. The last thing is when she comes up, we don't want to pinch her knee this way because we're putting a lot of pressure through that joint. So we're going to want to put pressure here, okay? So I'm not compressing her knee. So what I'm going to do here is I cradle, I have somewhat bigger hands, so I'm able to cradle her iliac crest from anterior and posteriorly. I am bringing her up as far as I can before I feel her go into that posterior pelvic tilt. And this is the flexion I would measure. Okay? Now, for passive range of motion, if I wanted to get to end feel, I'm not at her end range yet. This is the last part before her pelvis moves. To get end feel, I actually have to take her past that place where she's getting that posterior pelvic tilt to figure out what's going on for an end feel there. Are you doing okay?
Mm-hmm.
Okay? And so that feels more capsular to me. It's fine, 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 and then it gets bouncy at the end. But that's not where I'm going to measure. Now, we have the same problem, well, at least I do, because my arms aren't very strong, that I can't hold that leg and get an accurate measurement. Okay? That was the other thing. We still had rounding issues and weird, not acceptable numbers. Okay, so I'm going to have you, okay, what I want you to do is take this hand and bring it right where my hand is and hold your leg there. Just that hand though. Okay? I know, it's tricky. Okay, now I'm going to come back here. Yeah, right there. Okay? So now she's able to hold it. It's still a passive test. I didn't look for her. Okay, good. And you can relax for me. And so she's at 112 degrees of hip flexion. Okay? So remember that for hip flexion, it's really important to be watching that pelvis. And as soon as she starts to go into a posterior pelvic tilt, that's not what we want to measure. Now for active range of motion, I'm going to hold her pelvis and then have you bring your knee to your chest. Go ahead, bend your knee. There you go. Okay, can you come any further? Nope. Okay, but I'm monitoring there to make sure she doesn't go into a posterior pelvic tilt, and then I'm going to take my measurement again. Okay? All right, go ahead and relax. One of the things we noticed on Thursday is that people were actually saying things like, oh, it looks like it's about 5 degrees, or it's about 5 centimeters, or it's about this. This is a legal document, and you want to be able to document progress, so you need to be able to measure to the millimeter on tape measures, and you need to be able to measure to the correct resolution of your goni, which with the big ones is 1 degree. And you need to not guess, because you're going to use these numbers to document progress, and if you guess on the first day and you guess on the second day, who knows if you're going to guess in the right direction or not, and it's not defensible. So in general, you need to really practice reading your goni, reading your tape measure to that 1 millimeter or 1 degree, okay? Because some of you actually said, what's about? I want to know exactly what it is, not what it is. It's generally around. Okay, so that was hip flexion and extension. Now we're going to do abduction. We have great landmarks anteriorly, which are the ASISs. So for abduction and adduction, we're going to stick that stationary arm right across there. and we're going to put the axis on the side that we're measuring. So it's going to go just like that. Now, depending on your patient's pelvis shape, it may or may not be that you are bisecting the femur when you do that. So what you want to do is make sure that this is running parallel to the femur. Okay? So, but you want to use this as your landmark because it'll be stationary. So Jess obliged me very nicely. Thank you for that. So I have her lined up. She's at 90 degrees. If I was going to measure abduction active range of motion, what I'd like you to do is slide this leg out like you're making a snow angel with only one leg. It would be kind of weird.
It's hard without rotating.
And relax. I know, right? And that's the big compensation for this is someone pulls their toe out. So she went 10, 29 degrees, okay, of active hip abduction. Now, if I were going to measure passive, go ahead and relax your leg for me. I'm going to bring it out. So that's a muscular, there's a lot of resistance there. Make sure I'm not cheating. But now I would just set her leg down like this and then take that measurement. Now her pelvis has moved a little bit, so thanks for having great ASISs as well.
You're welcome. You can thank my mom.
Thank you, Jess Mom. Okay, so then I can take this measurement and now she's at, oh, go ahead and relax your leg, at 54 degrees. Okay, but when I measured her, her pelvis had shifted a little bit, so make sure that you're on those ASISs. Okay? So that was abduction. Adduction is going to be similar to what we had with the upper extremity, except we actually have a norm this time around. And so what we're going to do is just bring that leg across, just like as we did before. And then you're going to take the exact same measurement that you did for abduction. Okay? All right. Hip internal and external rotation are easy peasy lemon squeezy. So go ahead and have a seat there. So do you remember how we measured rotation at the, actually I'm going to take this one at the shoulder? We put the person in 90 degrees and then we measured down along through the humerus. We're going to do the same thing here. We're going to measure through the femur. Okay? So for Jess, her knee is a little bit lower than her hip. So I'm going to go get a towel so that we can pull her up so that her femur is parallel to the ground. Okay? So let me get a towel. Now a pillow won't work for this because a pillow is too soft.
What was it?
Did you know to wear workout clothes?
I always like to carry stuff like that.
Just always working out.
What do you think? Yeah, because we do workout clothes.
I think I'll measure this side since we've got the handle on that side. So I'm going to slide this under your leg. There you go. Is that comfortable? And then it's a scratchy toe. So, I don't know if you can see, gentlemen, her femur looks better now than it did without the towel. So we got her, it looked lovely to begin with. Her position is better now. So what we're going to do is measure her rotation. Now, just like with the shoulder, some people felt a little like, how is that rotation of the shoulder? For the hip, for some reason it's more confusing because we've added some extra flexion. So if you're bringing your ankle out, that's internal rotation, and if you're bringing it in, that's external rotation. Okay? So out is internal, in is external. So our stationary arm, because I'm tall, I put my stationary arm up because that's going to be closer to my line of sight. For some of you, it might be easier to have the goney down and be able to check and make sure that it's perpendicular to the ground. That's entirely up to you. The number should be the same. Okay? But for me, I'm going to put it up. So Jess, and then we also have this really great tibial plateau, not tibial plateau, the shaft of the tibia right along the front, which makes it really easy to align the goney. So Jess likes to hang out in a little bit of internal rotation. Okay, so her starting position is 7 degrees. I need to start wearing my glasses to class. Now, the only reason that would matter is if I couldn't actually get her to 0, which I can, right? So I could get her to 0.
But if you were gonna document like active range of motion, would it be 7 to whatever she can get to?
Only if she couldn't get herself to 0.
Okay,
Can you bring your ankle in just a little bit? Yeah, so she's got
Okay.
that range.
got it.
So then she'd be okay. But with her, that's a legit question, because even when I was pushing her, there was a little bit of resistance there. But yeah, she definitely likes to hang out.
Is your landmark just the bottom of the patella?
Yeah, right.
Okay.
The inferior pole. Thank you for asking that. Okay, so what I'm gonna have you do is bring your ankle out to the side, but what I don't want you to do is lift this up, and it's good that your hands are in your lap and not on the table, so good job with that. Okay, and you can relax. So we're at 32 degrees, okay? Almost normal.
So would you subtract 7 from that, or would it all count as external rotation?
So because I can get you to anatomical 0, anatomical position neutral, I would just say 0 to 32,
Okay.
okay? Now for palpating end feel for that one, I'm going to actually go through her knee and feel that end range. Now, for people who have a knee problem, this isn't going to be great because we're torquing at the knee. So you want to make sure that it's coming from the hip and not the knee. Now, I'm more interested in, yeah. So she's pretty tight in her external rotators. Okay, the norm is 35 to 40 degrees in both directions, and can you see that asymmetry and how, so that's how far she can go into internal rotation, and this is how far for external. So she's pretty tight there. And that's definitely a muscular end feel because her resistance just slowly comes on more and more and more, okay? Now, if I were going to measure passive range of motion, just for kicks, I'm gonna measure this way. 'Cause you're
That's the interesting side.
this is your interesting leg?
No, just saying.
Oh.
It's less normal.
Yes, this direction is certainly not normal. Sorry. I should be less excited about that. So she has 0 to 22 degrees, 23 degrees. Okay. All right, so internal and external rotation, you're going to measure like that. Then abduction and adduction, you're going to measure in supine using the ASISs. For flexion, you're going to use the greater trochanter as your axis and divide the torso and the femur. Remember, particularly for flexion, you want to not take the person into so much hip flexion that they go into a posterior pelvic tilt. That's less of an issue with hip extension, but you should be monitoring that. Okay? And those are our 6 motions for goniometry at the hip.
Dr. H,
Yeah.
so like during a practical, if we need help with holding the patient in the position, so do we just ask you, hey, can you hold the leg here
Yeah.
while I take a measurement?
Yeah.
Okay.
So one of the things about delegating in the clinic, which is a great question, you can ask an aide or someone to hold a limb that you have positioned, but you would never ask someone else that isn't a PT to take the measurement, okay, or apply the resistance. So you need to do those things that require the skilled services of a PT. But holding a limb once you've positioned it is something that you can give to us unqualified folk, okay?